Unfortunately, a lot of patients that we see in open heart surgery now are either morbidly obese or have multiple what we call comorbidities, things like diabetes or chronic obstructive lung disease, morbid obesity, and all these things tend to put extra strain on the sternal closure. People who have a lot of respiratory distress after surgery put a lot of stress on this, so it's much like walking on a broken bone. If you don't have the sternum very tightly and very rigidly fixed, then that sternum can loosen. Once that sternum loosens, then that allows for infection to get into the breastbone and into the area around the heart, which produces another set of very serious complications. The KLS Martin company has produced a device called a sternal talon, and what this clamp type device does is it not only provides for rigid fixation of the breastbone, but also compresses the breastbone. And from our orthopedic colleagues, we know that if we can compress a bone, that it'll heal faster and stronger. Keeping that breastbone solidly fixed together like this is extremely important in getting it healed. If you can keep the breastbone together and compressed, the chances of it healing are much, much greater. What we see with the stainless steel wires is that the stainless steel wires, many times with a hard cough or a sneeze, particularly in these heavy-chested patients, can actually break. And then once they break, then that sternum can slip and move. So far, we haven't had any cases of sternal wound dehiscence in patients that we use talons, and we used them really on some extremely high-risk patients. If you look at the cost of a sternal wound infection or a sternal wound dehiscence, that cost is probably estimated to be between $70,000 and $100,000 per patient. And so we feel like that although the cost of the talons do add cost to the procedure, if we can prevent one or two sternal wound separations, sternal wound dehiscence, sternal wound infections, it actually more than pays for itself over a long period of time. And we've used them on a lot of patients I feel like are extremely high risk for sternal wound dehiscence, and to this point we've had great success.